Mesothelioma is an aggressive and malignant type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the lungs, heart, and abdomen. There are typically no symptoms in the early stages of mesothelioma. As the disease progresses, it becomes painful and can cause serious health issues. Not treating mesothelioma poses significant health risks as the cancer is allowed to advance without any intervention. Some of the major risks of not treating mesothelioma include cancer progression and spread. Mesothelioma grows and spreads very quickly if left untreated. The cancer cells can multiply unchecked and invade nearby tissues and organs. Not receiving treatment means the cancer is able to progress to more advanced stages over time. Later stage mesothelioma is much more difficult to treat. Leaving mesothelioma untreated almost guarantees the cancer will spread from the area it originated to other parts of the body like the lungs, bones, or brain through the lymphatic system or bloodstream. This greatly reduces survival rates and increases complications. Organ dysfunction. As mesothelioma grows, it can put pressure on and invade vital organs in the chest or abdomen like the lungs, diaphragm, and heart. This interference with organ function can lead to life-threatening issues like respiratory distress, heart failure, blood clots, and infections. Organs may become severely damaged without treatment to remove or shrink the tumor burden. Vital organs losing their normal function is a huge health risk that reduces quality of life and life expectancy. Blocked organs and fluid buildup. Cancers affecting the chest can often promote a buildup of lymphangitic carcinomatosis, which causes a blockage of lymphatic vessels draining fluid away from organs and body cavities. This leads to dangerous pleural effusions where fluid accumulates in the pleural space surrounding the lungs, or peritoneal effusions with fluid building up in the abdominal cavity. The pressure from excessive fluids puts strain on organs and inhibits breathing or digestion. Tapping or draining fluids provides only temporary relief without actual cancer treatment. Severe, chronic pain. Many patients experience acute, increasing pain as mesothelioma spreads. There is no relief without managing the cause, which is tumor growth. As nerve tissues become invaded, the level of pain intensifies over time. Areas affected by the cancer become very tender and painful to move or breathe deeply. Chronic, high levels of pain have devastating effects on quality of life and mental health. It also creates metabolic stress on the body. Pain thresholds are exceeded without pharmaceutical or radiation-based pain management. Weight loss and cachexia. The metabolic stresses from cancer, pain, and organ involvement often cause patients to experience severe involuntary weight loss, commonly seen in advanced stages. This cancer cachexia is very difficult to reverse and promotes muscle wasting with the breakdown of body proteins and fat tissues. It is a manifestation of poor nutrition and the body literally eating away due to imbalances caused by the disease. Cachexia leads to frailty, weakness, and susceptibility to infections which lower immunity. This toxic systemic response increases mortality risks. Increased risk of infections. Unmanaged malignant pleural effusions or ascites provide an opportunity for bacterial infections like pneumonia, empyema, or peritonitis to occur. Cytotoxic chemotherapies or radiation is used to treat cancer but also suppresses the immune system, elevating risks. Cachectic patients have less reserve to fight infections which become life-threatening complications without antibiotics or drainage procedures to remove infected fluids. Respiratory or gastrointestinal infections kill many advanced cancer patients left untreated. Respiratory compromise and failure. Large lung tumors obstructing major airways leads to hypoxia, shortness of breath, and eventual respiratory failure if left unchecked. As pleural plaque formations grow over the visceral pleural lining the outside of the lungs, breathing capacity diminishes since the lungs cannot fully expand. Fluid buildup adds further strain. Many patients literally suffocate due to mesothelioma without relief via surgery, radiation, or other therapies to remove obstructions or relieve compressive symptoms. Bowel obstruction or perforation. Aggressive abdominal disease involving the peritoneum or digestive tract poses many risks without relief via palliative surgery, stents, or radiation. Tumor growth may trigger partial or complete bowel obstructions where food waste can no longer pass, leading to vomiting, dehydration, and malnutrition. Perforations form holes in the bowels, risking fecal leaks and life-threatening peritonitis. These complications demand prompt interventions but are fatal without them. Malnutrition and dehydration. As the disease progresses, the inability to eat due to pain, early satiety from organ compression, or bowel issues leads to poor nutritional status and weight loss. Nausea, vomiting or bowel obstructions also impair fluid intake, causing acute dehydration and electrolyte imbalances. This is a vicious cycle, perpetuating illness due to inadequate nourishment at a time when the body needs extra calories and protein to fight cancer. Parenteral or tube feeding may be necessary for hydration and caloric support. Bleeding complications. Malignant growth in the pleura or peritoneum risks erosion into major blood vessels, causing potentially catastrophic internal or external hemorrhage. Common sites are within the chest, like the intercostal arteries, or within the abdomen around the abdominal aorta. Bleeding requires urgent intervention with fluids, transfusions, angiographic embolization, or surgery to staunch. Unchecked internal bleeding proves fatal within hours without treatment. Superior vena cava obstruction. The superior vena cava, SVC, returns blood from the head, neck, chest, and arms back to the heart. Tumors arising from the mediastinum or hilar area often invade and obstruct this important vessel, causing life-threatening issues if not promptly relieved. SVC syndrome causes facial, upper body swelling, headaches, and potentially fatal cerebral edema without standing or other palliative procedures to restore flow. Failing to treat mesothelioma leads to rapid disease progression, multiple life-threatening complications, preventable organ dysfunction, severe pain, high susceptibility to infections, diminished quality of life, and malnutrition, cachexia. These cumulative risks translate to the virtual certainty of premature death as the cancer consumes the patient from within unimpeded. While mesothelioma remains an incurable disease for most, all available treatments, including chemotherapy, radiation, surgery, supportive measures, help prolong survival durations and secure precious extra weeks or months to spend with loved ones without pain or debility by managing disease-related problems. No treatment guarantees avoidance of additional symptoms, but maximizing outcomes requires aggressive, coordinated care guided by experts.